But there's this new reporting, the BBC talking about a new flu strain in China found in pigs, but that has pandemic potential. We're already worried about the regular flu season coinciding with coronavirus this fall. What do you make of this?
Well, this is something we've been keeping an eye on. This is called the G4 strain of H1N1. So this is a descendant of the H1N1 swine flu that people may remember from 2009, 11 years ago. What happens in these situations, they've been doing surveillance in pigs for some time, really since 2011. And for the most part, they have not been finding any kind of strain of flu or some virus that was concerning. But there's this one particular virus, the G4 virus, which kept showing up over and over again in pigs. And then they started to look at the workers, the pig workers, humans, and they found that it actually was present in a certain small, like around 10% of workers as well. So that's sort of where we are. What they haven't seen as of yet is any evidence of human-to-human transmission. So that would obviously be critical, and if it doesn't ever spread human to human, I think this is not something that we're going to have to worry about. But this is real. I mean, this is what virus hunters do. They keep an eye on things like this, and there's all these sorts of surveillance programs going on around the world. Most of them we don't talk about much because we don't want to freak people out. But this is one that we're definitely keeping an eye on.
Yeah, on top of everything else. Obviously, we don't need one more thing to watch. Sanjay, I want to address something because people who watch the pandemic closely have noted that the mortality rate, the number of new deaths every day, has consistently gone down. It's at a low ebb right now. Now, obviously, it's a trailing indicator. As these cases go up, up, and up, it might rise again. However, if there are younger people making up this group of people who are coming up with the new infections, what questions do we have about the mortality rate going forward?
Well, I don't think we still have a clear vision on exactly what the mortality rate of this virus is because it's always been influenced by so many other factors. But I think there's three points here. One is that this trailing indicator. So I think without question, there will be some impact from all these younger people who are getting the infection and subsequently spreading it. We've been doing a lot of metaphors on this program lately, but they would sort of be the kindling, if you will, for this fire that we're talking about. So not directly setting the fire, but maybe enabling it a little bit more. Two is that, you know, we have learned a few things over the past few months. We haven't learned as much as we would have liked, but we've learned a few things. Patients on ventilators maybe don't do as well as we thought, so ventilators weren't as critical to the care for a lot of these patients as we initially thought they might be. And there's a few therapeutics, remdesivir, dexamethasone. These are things that are being used that could have an impact. We've learned how to better manage these patients. But I think that the biggest thing is this idea that even if people aren't dying, if they're still in the hospital and the hospitals become overwhelmed, what ultimately is really driving these fatality rates is preventable deaths. People in Italy, what we saw, and it was really awful, I was talking to a lot of sources there at the time, was that people just simply couldn't get care. They'd be calling the doctor, calling the ambulance, and they'd be told, look, we're full. There's nothing we can do for you at this point. And so that drives up mortality rate as well, over 10% for a while in northern Italy. That wasn't because the virus had changed, that was because the hospital systems were too overwhelmed. So, you know, these three things in combination have to sort of be managed. The last one, obviously the most important, flattening that curve. But ultimately, we hopefully will continue to learn more in the form of convalescent serum and other things to really help take care of these patients.
There's been a real focus on young people as we're seeing the average age of infection trend down. But we're also hearing from governors around the country that they're concerned about how young people are spreading it, that they are perhaps a little bit more cavalier in their actions. There's a bar in East Lansing, Michigan. 107 cases have now been linked to that, all between the ages of 19 and 23, which begs the question not only of how much it's spreading, but also how concerned we should be about younger people getting sick, because as we heard you know, from a doctor in Miami this morning, he's seeing younger patients, but they're sicker.
Yeah, so, you know, overall, if you look at the percentages, I think the data that's held up is true, that younger people are less likely to become critically ill. But the problem is, I think to your point, Erica, is that as more and more young people get sick, the absolute number of young people who develop some devastating illnesses is going to grow because there's just more people who actually have the virus. I think, you know, what we're seeing is the message to vulnerable people, older people. My parents live in Florida. They're in their late 70s. They get the message that they're really trying to be careful. So, and people who have pre-existing diseases, for the most part, trying to be careful. But I think for other people, as they become more cavalier, it could have been expected that this very contagious virus would start to affect them more. I think the big question as we go into fall, as we go into winter, is how much of that spread is then going to go back from younger people, inadvertently, admittedly, from younger people back to these vulnerable populations. I'm fearful that that's going to happen. That, you know, there's going to be people who've been doing the right thing. They've been, you know, managing themselves at home as much as possible, just going out for essential things, who are inadvertently going to become infected because the virus, the amount of virus in the environment just becomes too high.